This is part 3 and the final video. We're going to pick up with prioritizing and active listening. So try to verbalize why you're prioritizing certain needs. For example, if you have two call lights going off and there's one person that needs to go to the restroom while another one is asking for pain medication, you could work on delegation in this aspect as well and say, okay, we can delegate the bathroom while we go assess for pain. Thinking about active listening, and this is such an important skill because it's listening with a purpose and avoiding quick action. It takes you out of the equation. We take ourselves out of the equation and we try to focus on the meaning of what the individual is trying to say. So this whole entire slide has discussed what we're supposed to communicate, but ultimately communication is also listening to what the other person has to say. So now we're going to move on to delivering feedback. And this can be one of the most challenging things as a preceptor, is delivering feedback. But I want you to note that feedback does not always mean something negative. We can also deliver positive feedback as well. It can also be helpful when you deliver feedback to use a type of sandwich approach wherein we provide something positive, an opportunity for improvement, and then again, reinforcing what what has been good. I also love this method here, displayed on the slide for actionable feedback, in that we can reinforce strengths. For example, you did a great job of establishing rapport with your patients today, but pinpoint that opportunity for improvement. Could be perhaps we need to work on time management. What's the impact of that? Well, if we don't get started as quickly as possible with our morning med pass, then that's going to set us back for the whole day. Or perhaps you need to document as you go along, and let's try to document while we're in the patient's room instead of writing things down and waiting till later. So notice that, providing that clear guidance. Okay, so time management is the issue, but here's the impact and how can we work on that? Now let's look at some clear guidance for the shift. How can we put these things together? So we should start the shift, and this does not have to be a long meeting, but just briefly looking at what are the goals and objectives for the day. Using the tiered approach is great because, as you notice, each tier was only one page. So you can glance at that page and know what your priorities are for the day and just checking in. Also remember the skills tracker, which can be completed at any point during the orientation. So maybe if you're on 4-HVT, they may want to look for opportunities to pull sheaths. There may be maybe want to look for opportunities to do IV practice. But just checking in briefly. During the shift, let's of course remember patience, as I mentioned before, and that positive attitude. Try to validate competency as you go along that day. Let's try not to wait till the end of the week, because that's also going to help them be able to move along in the tiers. Then after the shift, or even toward the end of the shift, it doesn't have to be, after you've given report and clocked out. It could be while you're waiting to give report. Take a few minutes to ask, okay, how do you think today went? What are some things that you did well? Often what you might have on your mind that they need to work on, they're already aware. So in letting them provide their thoughts to you, they can lead in that direction. So you do a quick debrief. What went well? What can we work on? Remember to offer that praise as well as opportunities that you see for improvement. And again, encouragement. So now we are going to move on to some resources that you have available to you on Careline and look at some other tools. So when you log on to Careline, if you click on the nurses portal, you'll see there is a circle for orientation preceptor. When you click on that, there will be several resources available there for you. You can also access the Elsevier clinical skills. It will be over on the right hand side of the page. as well as show them where the document manager is. There are feedback cheat sheets, which I'll pull up in just a moment. I'm going to have them loaded in the Teams page, as well as they're on Caroline, and some other tools that you can use. So as I mentioned, the documentation tools that you'll have that you're responsible for will be that competency validation tool. There is that weekly evaluation, and then the survey that will be completed at the end of orientation. And please also don't forget to provide continual feedback. That can be verbally throughout the day. You can also write down feedback on the tier, on that page for the tier on the orientation tool, and provide feedback in the weekly evaluation. So I'm going to show you some of the tools that are available to you on Caroline, as well as a few things that I've loaded here in the Teams page. So if you click on Files, you'll see there are instructions on what to do. Very brief. You are to watch these videos in the Watch Me folder, as well as complete this quiz. But there are some other optional tools. We have a learning styles quiz. If you've never done that before, if you don't know your own learning style, it is really helpful to do that, because we often tend to teach the way that we learn. So it's good to know what your preceptee, the orientee, what their learning style is as well, because we want to try to match that up. There's a link on Caroline to do the quiz, and then also here. There's also some information about self-care that can be for you or your orientee. So I'm going to pull up the clinical judgment. Document. Let me just slide this over. All right. So with the clinical judgment document, this could be, maybe you have high risk, low volume things that you might see on your unit. You could use this document for that. You can do certain complications or even a diagnosis that you see often. And this is just a way for them to go in and drill down into that data. What's the complication? What are the things that you would see, that you would expect to see with that problem? And how would you manage that? What are the nursing interventions that we would do? Now I'm going to pull up prioritization. I love this prioritization document, especially if you have someone that's struggling. So what you do as the preceptor is you would come up with a list of relevant problems, and this could range from someone's asking to go to the bathroom or needs pain medicine to someone's complaining of chest pain, or there's an out of range blood sugar that is at a critical level. You know, whatever is pertinent for your unit, you can fill in these problems, and then have your orientee rank those or prioritize those, and consider what is the most important. So earlier in this video, when we were discussing feedback, I mentioned the preceptor cheat sheets. These are available on that orientation preceptor page, but I've got them here for you as well. And in this document, I zoomed in just a bit, and in this document, this breaks down the reinforced strengths, opportunity for improvement, highlighting the impact, providing clear guidance. It just breaks it down for you a little further, and what questions or things that you should do as you're going through that with the nurse. On the second page, I love this because it takes different types of preceptees that you may encounter, for example, the apologizer, the denier, the tearjerker, etc. And, you know, how can you, as the preceptor, how can you handle that, and some suggested things that you can say to bring that conversation back around for feedback. And the last page is a guide to clinical questioning. And in this, if you'll notice, that's noticing, interpreting, responding, reflecting, which matches with that Lassiter clinical judgment rubric. And it gives you suggestions on when to use each of these things and what types of questions that you can ask to help lead them there. And clinical judgment is one of those things that many of our new nurses are struggling with right now. And the best way to approach that is in asking questions and trying to lead them to the answer, instead of just providing the answer for them, but going through a series of questions to help lead them to that result. It's kind of like that old saying, you know, if you give a man a fish, he'll eat for a day, but if you teach a man to fish, he can eat for a lifetime. And that's what we want to do, is we want to teach them how to critically think instead of just giving them the answer. So in closing, I wanted to revisit our TSAM model. And I want you to notice, what is the preceptor supposed to do? Modeling best practice, narrating care, providing feedback, and open communication. So I believe that your manager would not have chosen you as a preceptor, would not have asked you to be a preceptor if they did not already believe that you're doing a great job at what you do, that you're not a great nurse. So you just continue being that great nurse that you are. And also remember, as you progress through the tiers, let's try not to push things before we get there. There are going to be opportunities that you will want to take advantage of. Like, for example, you can't say, oh, well, we're not going to participate in this code because that's not the tier that we're on. Okay. No, you're going to definitely jump in there and let your orientee experience that. Those are things that fall under that skill tracker. Those are things that you can do at any given time. However, we really do want to focus in on what are the skills for that particular tier and give them lots of opportunities to practice that before you move them on. And then, of course, bring those skills along as they continue to build and get better at each thing. Assessment and documentation, this is going to be the foundation of everything, because as you know, we should not do anything else, medications, or we can't deal with any of these other things until we have that assessment piece down. So in closing, our goal for TSAM is that we want to provide the best orientation experience that we can. We want to make it where it's doable for the preceptor and that the orientee has a good experience. We want to be able to retain these nurses, and evidence shows that if you have a good orientation experience, you are going to be more likely to stay within that organization. If you have any questions, feel free to email me, julia.ferguson@rsfh.com. You can also reach out to your clinical specialist. Remember, after this video is completed, to go do the brief quiz from the link that's in Teams. Thank you.